quality. It's the difference between a good steak and a delicious dinner. It's the difference between a loaf of bread and a slice of heaven. It's fruit that tastes like it was just picked, vegetables that are farm fresh. It's the nice yet knowledgeable service. Simply put, it's a better way to live. Come home to quality at IGA.
For the interior, the key target was to increase the feeling of quality. European manufacturers have improved the quality of their materials and the touch and feel of their interiors. Honda was a bit behind these standards, so we have changed our approach to match customer expectation and European standards. The new Civic has a high-quality cabin, both in the way that it feels and the way that it looks.
One of the most important things that happened in that report was that it gave names to the dimensions of quality. If you're buying a car, there are dimensions of quality: safety, fuel efficiency, comfort, fun in driving, durability, and so on. We're used to that. Well, what are the dimensions of goodness in healthcare? And the Institute of Medicine Crossing the Quality Chasm report gave us 6 dimensions and said these should be the areas for healthcare to improve on. It also summarized a lot of the research literature on the current levels of performance for those 6 areas. And here are the 6 areas. The first one is safety, back to the report from a year and a half earlier, To Err is Human. Safety means we're not harming people with our care. We're not adding to the burden of illness. So a safe healthcare system reduces hazards and risks from the care itself, safety. The second dimension they called effectiveness, and that was a term that sort of was meant to mean matching science to care. So if science says that this drug can help in this disease, then we use that drug. And if science says this can't help, we don't use it. So avoiding overuse of things that don't help and assuring use of things that do help, avoiding underuse, that's effectiveness, lining up science with care. There are big problems in effectiveness. The Rand Corporation famously published a study a few years ago which showed that of the needed effective care that Americans should get, when they tracked 7,000 people over 2 years, those people who had all sorts of things ranging from just well care to serious chronic illness, those 7,000 people failed to get 45% of the care that would have helped them. So that's effectiveness. The third dimension is patient-centeredness. And this is a pretty subversive goal. It means people should be in control of their own care. They should make decisions about what affects them. We say, nothing about me without me. It's putting the patient in the center of the care system and giving them power and control over their own lives and their own care. The fourth dimension is timeliness, which means avoiding delays. People are quite familiar with waiting rooms. You know, we wait a long time to get to see the doctor in the emergency room or waiting for an appointment. In all other industries, timeliness is an important dimension of quality. You don't want to wait everywhere. Well, nor do you in healthcare. So timeliness is reduction of needless delay. Some delay is instrumental. You want to wait to see what happens, but there's a lot of non-instrumental, very costly delay. The fifth dimension is efficiency, which means avoiding waste. We throw out so much in healthcare. We give things that can't help. We duplicate procedures and tests. We lose records. We lose the ideas of the workforce by not inviting them to join in invention. So efficiency is a big word. It means stop wasting stuff. We're very, very wasteful in healthcare. The last dimension, which some people think should be the first, is equity. And that means closing the gap in justice in healthcare, basically. Right now, the biggest predictor of your health status in our country remains your race. If you know someone's race, you know much more about their future in health than almost anything else I could tell you about them. A black baby born in inner city Baltimore this year has a life expectancy of a male that's 7 or 8 years less than a white baby. That's a quality dimension too, equity. So safety, effectiveness, patient-centeredness, timeliness, efficiency, and equity. Those are the names of the dimensions of quality that the Institute of Medicine says we should work on.
Quality in higher education, there was a famous line I love from Sir John Daniels, who used to run the UK Open University, said that American higher education is unique in the world in defining quality in terms of exclusivity of access and extravagance of resource. What is quality? Ask ourselves, what do we think quality higher education is? And we usually come up with a picture that has to do with Nobel Prize faculty, has to do with extremely high test scores among the students, has to do with beautiful facilities, small classes, all of these things which we think of as the evidence of quality. I'm sure everybody on this panel, since we work in education, have had the little counseling sessions with distant family members saying, how do I get my kid into college? Negotiating that system. I was talking with a cousin of mine just last week about this. And I can't tell you how many times people have said to me, well, this university must be better because it costs more. And how am I going to pay for it? That is simply all has to change. The only thing that matters
That's
is
what they
outcomes.
say about Jaguars also. It's
Right?
like,
Yeah. Right. So that's a core assumption that has to change. I'll mention one. You asked about innovations a while back, and this is not a very glamorous innovation, but it's the one that came to mind of a real innovation. A number of states this year have passed changes to their higher education funding formulas to fund universities more on completion, on graduates, rather than just enrollment. Now, that's a real innovation. Now, in one state that I know of, happens to be Indiana, which was faced with the need to make some mid-year budget cuts, used that formula to allocate the cuts. Now, you talk about it, doesn't sound like a very glamorous innovation, perhaps to some of us here, but to me, that's a glamorous innovation. That is a real shift of thinking about how you approach the incentives under which higher education operates.